What you should know before getting stacked nostril piercings. Coming up next on Consultations by a Piercer, episode number 24. For those who are new to the channel, first off, welcome to the Body Piercing and Tattooing channel. Hope you're enjoying the videos. Hope you're finding them helpful, but you might not know who I am. My name is DaVo. I'm a professional body piercer and have been since 1994. I own and I operate the Axiom Body Piercing Studio located right here in Des Moines, Iowa, inside Skin Kitchen Tattoo. So what we're going to talk about today is multiple stacked, as in one on top of the other, nostril piercings. It's become very popular and very interesting, commonly done with a stud on the top, ring on the bottom, or offset a little bit, depending on what your style is and your anatomy and what looks good there and what combination of jewelry looks good there. So, first off, average healing time, anywhere from 2 to 3 months, during which time we're going to suggest cleaning twice daily using a sterile saline spray. Personally, my favorite is NeilMed's Piercing Aftercare. Comes out in a fine mist, very easy to use. Just spray it on both sides, let it stay in contact for about 5 minutes, and then pat it dry. Do that twice a day throughout the healing period. The other thing I suggest doing is in the shower, at the end of it, pull everything out of the way and just let the water flow over the area for about 30 seconds. What we're doing with those two things is we're removing that limp discharge, the stuff that hardens and crusts on the jewelry, the crusties, the dreaded crusties. And the reason why I want to get it off there is when the jewelry shifts or moves, it will agitate the piercing. So removing that makes the piercing easier. Cross-contamination prevention. Common sense things. Wash your hands before you handle it. No oral contact. No exchange of bodily fluids. Keeping your environment clean. Clothing, bedding, towels, anything that may come in contact with the piercings needs to be cleaned on a regular basis. Do not submerge piercing in bodies of water you cannot control the quality of, which is everything but possibly your own clean and well-maintained bathtub. I don't care how much or how well treated the pool is. The reality is it's a standing body of water, and it contains microorganisms, and you have, well, if you did both of them at the same time, 2 open wounds on your face, which are a perfect pathway for a pathogen or microorganism to work its way in there and cause all kinds of havoc. So don't swim until it's healed. Keep pets away from it. Don't let them sleep in the bed with you, especially those smaller animals that like to sleep up by your face and steal your breath while you're sleeping. Trauma, pressure, and abuse. Do not sleep on the piercing. Make sure you're sleeping on the other side or your back. If you have to sleep on that side, figure out a way to elevate those piercings off the bed. Also, avoid any pressure or contact. Isolate it as much as possible. It is your nose. Rubbing it and touching it is something you don't want to do. Do not spin the jewelry, rotate the jewelry, move the jewelry, take it out to dinner, or hand it over to your friends to borrow for the weekend. Leave it alone. Don't play with it. You'll have the rest of your life to spin to your heart's content, but while it's healing, we don't want to do that because it'll cause problems. Jewelry. Most common, or what I generally suggest, is a flat back little brace stud, threadless preferably, but you can use threaded. Very simple, easy to do, or easy to work with. When you're piercing initially, it will be pierced with a longer barbell or post than needed, and then we suggest downsizing in roughly 4 to 6 weeks. Other options would be nostril screws or L-bends. You get into trouble with this. Because those piercings are directly above each other or right next to each other, it can cause tanglement and issues with the jewelry sitting right. It's going to be a pain is what I'm getting at, and it really is going to take up a lot of room inside your nose. It's best to go with the LeBray studs. They're easy to deal with. Their flatbacks are minute. Get them all the way down to 2.5 millimeter, and it's not going to interrupt life as much as those other types of jewelry. Everybody always asks about rings, so I do not suggest wearing rings or switching to rings until the piercing is seasoned, which means roughly 6 months to a year before you change it. The main reason being is we're taking something that's completely flat and straight and then putting something curved in it. This could cause agitation, even in a healed piercing. As the body strengthens the piercing or seasons it, it slowly expands, so it's easier to put that curvature in there. Let's talk about anatomy. The reality is everybody who has a nose probably has the anatomy to get this done. Now, the size of your nose may dictate whether or not stacking the jewelry and keeping it far enough away where it's going to look okay and look right is dictated by the amount of space we have to work with. Just like in earlobe or upper ear cartilage or anywhere on the body, it all comes down to you having enough space in your anatomy for these particular piercings. Generally, if you're piercing for rings, they're done a little bit below. Just for studs, they're usually done on the crease of the nose. So a lot of times what we'll do is the top one on the crease and the one below it for the ring, possibility a little bit lower. Now let's talk about placement. Usually these are done as an additive to an existing piercing that's already in there. Usually what will be done is below the existing one or above it. It really depends on what you have there, but a lot of times it's not a problem to switch over or do an additional one. Generally straight up and down, or appearing to be straight up and down, to match the other piercing as far as how far back on the nose it is. Now, it can be perfectly stacked straight up and down, or it can be at an angle or offset. It really depends on what look you're going for and how your nose is shaped. Whenever marking, if you are planning on wearing a ring, it's a good idea to mention it to your piercer so they can lower the position so you can put smaller rings in there once it heals. What to consider? First off, if you're involved in any type of sporting activity, hobbies, drama, anything that may have a rule book with a dress code in it, you may want to speak with whoever's in charge to find out if it's okay if you have this piercing or multiple piercings on your nose while competing or involved in those activities. Retainers are a possibility, but really, to be honest with you, in most cases, they're going to see it. These piercings cannot be hidden. They're on the front of your face. It's a given. Even clear glass retainers are going to be somewhat visible if the person is close enough to you. It's best if you're in a situation where you're not allowed to wear these to just wait until you're done with that job, activity, what have you, and then get it pierced. Are you going on vacation? When you go on vacation, you're putting yourself in an environment that you're usually not in, which makes you a little bit more acceptable to infection. You also can't control the environment as much as you can your home environment. The other thing is most people when they're on vacation, they like to swim, and you shouldn't be swimming with a fresh piercing. Lastly, I always cover it, sleeping and isolating. Do not sleep on it. Isolate this piercing as much as you possibly can. Till next time, here's hoping all your piercings heal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I hope to see you for your body piercing needs in the future. Have a good day, everybody. Thank you for watching.